Good afternoon, everyone. Hope everyone's doing well this afternoon, and thank you for joining me for this Medicare Supplement webinar. I'm Robb Giambrone. I'm Brokerage Director here at KAFL, Brokerage Director of Senior Benefits, and come to you with it's now 17 years of experience in the Medicare space. Prior to me joining KAFL 2 years ago, my expertise really was with Medicare supplements, where I was working with an agency that was more doing more Medicare supplements versus Medicare Advantage. And now working with a company at KAFL, it's kind of flipped with more Medicare Advantage, a lot more Medicare Advantage as compared to Medicare supplements. So I'm excited to present to you why Medicare supplements, why the value of Medicare supplements, how you can make money selling Medicare supplements, and give you comparisons with costs for Medicare supplements versus those costs with a Medicare Advantage plan. Before we begin, just a few housekeeping issues. If you have any questions, be sure to type it into the chat feature there on the Zoom using the chat function, and I'll be sure to address questions as they come about, or at the end of the conclusion of the presentation. So to speak about the need for Medicare supplements or supplemental costs for Medicare, the need for Medicare supplements or Medicare Advantage plans is tremendous, with the average cost of retirement for healthcare costs in retirement for a couple turning 65 is currently at $330,000, according to Fidelity's most recent study that they do annually in August. So the cost in 2024, $330,000 for a couple turning 65, and that cost consists of Medicare's out-of-pocket costs for co-payments, co-insurances, and deductibles for doctors or hospital visits, Medicare Part B and Part D premiums for doctor appointments, preventative care, prescription drugs, and the co-pays associated with medications for your prescription drug policies with Part D. And when it comes to selecting Medicare coverage, understand that these costs are increase every year. This cost is up 5% over 2023. And costs can depend on your personal factors like your age at retirement, the number of years that you plan to be in retirement, and one's general health or your risk comfort level when choosing your Medicare plan. And when it comes to selecting Medicare coverage, many Americans, this study indicated that many Americans that are approaching retirement age are concerned that it's a lot easier than said than done. 55% of Americans say it will be difficult to enroll in Medicare coverage, and half expect it to feel overwhelmed or confused when selecting their plan. Recent Fidelity research finds that the average American estimates that costs will be about $75,000, which is less than half of Fidelity's calculations. That's $75,000 individual costs, which is less than half of Fidelity's calculation. There are currently 66,300,000 Americans enrolled in the Medicare, with nearly 50%, now over 50%, enrolled in Medicare Advantage plans, and with Medicare supplement plans providing some stability in the market. We'll kind of delve into that a little bit more throughout this presentation. A little bit of background to give you a little bit of background regarding Medicare that many of you know, but for those that are needing to understand the costs of Medicare, I like to refer to this slide as the need for Medicare supplement plans. When somebody is enrolled in Medicare, Part A is your hospital insurance, and that comes with some very significant out-of-pocket exposure. A $1,676 deductible for inpatient hospital care, which is per benefit period, which is benefit period is 60 days. And beyond 60 days, it's a cost of $419 per day. And days 91 through 150, $838 per day, or called, often referred to as the lifetime reserve days, and all costs per day beyond 150. So if one were to just have original Medicare and not a Medicare supplement plan or a Medicare Advantage plan, they would be responsible for all of those costs out of their own pocket. With regards to skilled nursing care, days 21 through 100 is $209.50 per day cost to the Medicare beneficiary. For hospice care, it's $5 per outpatient prescription drug and 5% of the Medicare approved amount for inpatient respite care. And if one were needed a blood transfusion, they'd be responsible for the first 3 pints of blood. So as we get into this presentation, we'll demonstrate to you that Medicare supplement plans will pay for these expenses. As for Medicare Part B, your medical insurance, your outpatient, your preventative services, diagnostic tests, therapies, durable medical equipment, those costs for 2025, the monthly base premium for Medicare Part B is $185, but certainly for higher income earners, that premium can be significantly more. The deductible for Part B for 2025 is $257. And Part B is an 80-20 plan where Medicare pays 80% and the beneficiary is responsible for 20% coinsurance. Now for a difference between Medicare supplements and Medicare Advantage plans. So when one is turning 65 or otherwise eligible for Medicare, they have a choice. They can either enroll into a Medicare supplement plan or a Medicare Advantage plan. A Medicare supplement plan, by definition, is a plan that pays for the copays and out-of-pocket costs, deductibles, coinsurances that are left to the beneficiary from original Medicare that I discussed in the previous slide. With the Medicare supplement plans, they have higher premiums, but typically lower or no copays and no out-of-pocket exposure, except for the Medicare Part B deductible, that again is $257. With the Medicare supplement plan, you can have the freedom to choose any doctor anywhere in the country without having to worry about whether or not that doctor is in network. With the Medicare supplement plan, you don't have to have any referrals, have your primary care physician. With Medicare supplements versus Medicare Advantage, though, with Medicare supplements, they don't provide other routine benefits like dental, vision, or hearing, but they are covered anywhere in the country. As compared to a Medicare Advantage plans that are HMO or PPO plans or special needs plans or fee-for-service plans, they're generally lower premiums, 0 to little premium per month, in exchange for higher out-of-pocket costs that can be as high as anywhere up to $79 or $100, $8,000 annual maximum out-of-pocket costs on certain Medicare Advantage plans, depending on the area in which you live, the carrier, and the plans that are available. With Medicare Advantage plans, they like to focus on the whole person healthcare and wellness. And they do include additional benefits, oftentimes, like, certainly your prescription drugs are covered in the Medicare Advantage plan, dental benefits, hearing, as well, with most carriers. With Medicare Advantage plans, they're restricted to networks, either an HMO plan that is more restrictive than a PPO plan. With a PPO plan, you can go out of network and pay a higher copay. And again, they may include extra benefits like vision, hearing, or fitness even, or benefits like ride shares. As for emergency services, Medicare Advantage plans like Medicare supplements will pay emergency services outside of service area. So No concerns regarding, when if somebody were needing to seek emergency care, that would be covered. Now for the heart of the presentation to really talk about Medicare supplements. Medicare supplements really provide a lot of stability for beneficiaries. Low out-of-pocket costs. So with uh, Medicare supplements, you pay your annual premium and your monthly pay on a monthly basis. The annual premium, a competitive annual monthly premium for a Medicare supplement plan G in New York State is $305 with Globe Life. Outside of New York, we're seeing the average premium for a plan G be about $164 outside of New York and other states. With Medicare supplements stability, again, no networks. Your consumers are not having to face whether or not the doctors that they see, their specialists, their primary care physicians, if it's like a cardiologist, a neurologist, whoever that specialist may be, they don't have to worry about whether or not that specialist is in network. As long as that medical provider is accepting Medicare, then the Medicare supplement will be accepted as well as a secondary insurer. Medicare supplements are standardized benefits that we'll discuss in more detail. With standardized benefits, the benefits for the plans are the same regardless of the carrier. So your benefits with a Mutual of Omaha Medicare Supplement Plan G versus a Globe Life Medicare Supplement Plan G or Aetna or whatever the carrier may be, the benefits are the same. So your consumers and the Medicare beneficiaries don't have to be concerned as to whether or not, they hear like, oh, their sibling or their next door neighbor or their friend, oh, they have this plan and I want to make sure it has this service. There's no concerns with that with Medicare supplements. Everyone has the same benefits, regardless of the carrier. They may be paying more or paying different premiums, but the benefits are the same. Medicare supplements are also guaranteed renewable. This is a really important point. Medicare supplements being guaranteed renewable as long as one continues to pay the premium, that coverage is guaranteed to stay in force. With the Medicare Advantage market that we experienced this past annual enrollment period, many of you can sympathize and understand that there was a lot of turmoil in the market. Carriers, we had more plan terminations nationwide than ever before in the history of Medicare Advantage. That caused a lot of disruption in the marketplace. A lot of many Medicare beneficiaries had to switch plans to another carrier, and many of us on the call right now were working, midnights, working the late night hours to get everybody enrolled into a new plan because of all of the plans that were terminated or not renewed for the current plan year. So with Medicare supplements, though, again, no concerns for that plan staying in force. As long as the premiums are paid, that plan will remain in force. There will be rate adjustments, but again, the plan will remain and you'll have coverage. We have a very strong portfolio of Medicare supplement carriers that we're offering with Globe Life, very competitive offering in New York, Mutual of Omaha, Aetna, AARP, Humana. There's going to be options for us to add other carriers as well. We also offer Allstate and Cigna. But if you have other carriers that you'd like us to inquire about, or you have clients that are asking you about other carriers that they know that they have more affordable rates, then please let us know. We want to make sure that we are making those available and can consider it for getting contracted with those carriers if it works well for a lot of our producers. Again, if anyone has any questions, please feel free to write those into the chat feature there on Zoom, and I'll be sure to address them. So this slide shows a standard outline of coverage for Medicare supplement plans. The most commonly sold plan right now is Medicare Supplement Plan G that pays for all of the uh, deductibles and copays that are left to the original left to the beneficiary from original Medicare, except for the $257 Part B deductible. For if anyone has clients that are Medicare eligible before 2020, before January 1st of 2020, then those beneficiaries are also eligible to enroll in Medicare Supplement Plan F or Plan C. Plan F is the Cadillac plan for Medicare supplements that pays all out-of-pocket expenses, including that Part B deductible. But again, for those eligible from January 1st, 2020 and going forward, Plan F is no longer available. They have to enroll. Plan G would be the plan that is going to provide the most benefits. Plan N is another popular plan that many carriers offer and is a very accommodating and more affordable for Medicare beneficiaries. It has, like the Plan G, it does not pay the Part B deductible. It has a $20 copay for an office visit when the plan ends, and a $50 copay for an emergency room visit. And it also doesn't pay any Part B excess charges. Excess charges being if a provider were to not accept assignment, which means that they will accept Medicare, but they don't agree to the Medicare reimbursement rates, they can charge up to 15% more than the Medicare allowable rate. And where the Plan G will pay that Part B excess charge, that's the only plan right now that pays that in addition to the Plan F for older beneficiaries. But the Plan N does not pay that Medicare Part B excess charge, but it is in a more affordable premium. Also, please note that Plans F and G have a high deductible option, which beneficiaries pay the deductible, the plan deductible of $2,870 before the plan begins to pay. And once that deductible were to be met of $2,870, then the plan would pay 100% of covered services for the remainder of the year. Further, with the plan, high deductible Plan G, you're looking at a premium, a much lower premium, about $60 a month. So for those who are used to and accustomed to paying a high deductible, it's a very good option for many beneficiaries. Medicare supplements are simple for advisors to offer your clients Medicare supplement plans. It's simple for advisors who are many financial planners who know that they have clientele who need guidance about Medicare and need to know that they can get enrolled into a supplement plan and help with Medicare's out-of-pocket expenses. Simple for Medicare for advisors to sell Medicare supplements because unlike Medicare Advantage plans, with a Medicare supplement plan, no certifications. You don't have to study. You don't have any tests to take. As long as you have a life and health license, you get appointed with the carriers that I would recommend. Once you're appointed, you can go out and sell policies to your clients and get paid. So again, a much simpler process for advisors to get up and running and get going to selling Medicare supplement plans than it is with Medicare Advantage. Medicare supplements are a fantastic way to help advisors build revenue. Many of those who are selling Medicare plans, whether it be Advantage plans or Medicare supplement plans, they're doing that as in addition to the main focus of their business. If you're a financial advisor, if you're a P&C agent that's selling property and casualty, or maybe you're employee benefits, Medicare plans and Medicare supplement plans are plans that can be sold in addition to the main focus of your business. So for your clients that are nearing Medicare eligibility and they need that guidance about Medicare, this is a tremendous way to help, provide more value to your clients, but also to help you build revenue and make additional income. With Medicare supplement plans, you're seeing a commissions pay with Globe Life here in New York is 16% level for life. That's also the commission that's available nationwide in most states with Globe Life or United American. And most other carriers are paying about 22% commission years 1 through 6, level commission, and then 5% trail years 7 through 10. So a tremendous way to build revenue and add additional income to your portfolio. This is one of my favorite slides. I was able to put together an illustration that shows, how you can build your revenue, how you can make money selling Medicare supplement plans with a New York comparison versus a other states, non-New York states. So with in New York, like I mentioned, Globe Life offers one of the most affordable options at $305 monthly premium, at a 16% commission, annually on one policy, $585.60. If one were to sell just one policy a month, that's over $7,000, but selling one a week, an additional almost $30,500 in additional revenue. And you can see that with Medicare supplement plans, it's all about the renewal commission. So with renewal commission being level, if an advisor goes about and selling the same amount of policies that they sell, in year one, and then they sell the same amount in year two, and so on and so forth, you're going to earn all of your first year commission, and in addition to that, you'll earn your renewal year commission from the previous years. So it really builds up after, very significantly year after year. I had many advisors throughout my career who have really kind of bought into the fact that, the Medicare supplement, the commissions that they earn on the Medicare supplement in the renewal years really help, honestly, fund their retirement. I have other advisors who have explained to me that, they look at their Medicare supplement as a way for them to find a significant expense in their budget, like a mortgage payment, and they make it a priority to making sure that they're selling enough of these plans to cover a major payment like a mortgage, while their other main focuses of their business are really funding their lifestyle. So this is a tremendous illustration. So you can see that in 6 years, if you're selling one Medicare supplement plan a week, you're earning between $135,000 outside of New York. In New York, it's over $180,000 because premiums in New York are much more significant than they are in other states. Because in New York State, Medicare supplement plans are guaranteed issue. They're not take any health consideration into effect when enrolling. So anybody who's Medicare eligible can enroll into a Medicare supplement plan in New York State without any underwriting, as opposed to the other states. So more, less affordable in New York, but higher commission. You make more money on a percentage base than you do in other states. With Medicare supplement plans not including prescription drug benefits, when you're enrolling a client into a Medicare supplement plan, it's important to also advise them of their costs for prescription drugs. And they have to enroll in a standalone prescription drug plan. We offer several carriers that have standalone prescription drug plans. Right now, I see a lot of affordable options with Cigna There's also United Healthcare and Humana. Those are the carriers that I know of that are, having affordable plans, relatively speaking, and also are paying commissions. So other carriers are offering prescription drug plans, but unfortunately, many have, some have not chosen to cease paying commissions on some of their prescription drug plans. So I can provide more details on that on a specific basis if anybody has a specific question regarding a specific carrier. So with Medicare prescription drug plans, they're individually issued plans run by private insurance carriers. They're with each Medicare prescription drug plan, the drugs are classified into specific tiers, with each tier being so like your tier one drugs are your generic, very low cost, very low copays, sometimes even a $0 copay. But I usually see them, $5 copays or less with regards to generic drugs in tiers one. And then upwards, as the tiers become larger, so tiers 4, 5, and 6 are your more of your significant drugs for like cancer, cancer treatments, diabetes. But it's also important to know that with prescription drug plans, this year in 2025 is the first year that the costs for Medicare prescription drug plans, the out-of-pocket cost is capped at $2,000. And that cost is a combination of the beneficiaries' costs plus the insurance carrier's cost. So it's a $2,000 total maximum out of pocket. So in some cases, you may have a client who pays like $1,000 because that was their contribution of their costs or their portion of the costs, and then the carrier had to pay the other 1,000. So this though there's been some difficulties or some challenges, I should say, with regards to how this $2,000 max out of pocket is managed and how the carriers are managing it and responsible for more of the financial burden on these. It's a fantastic policy and regulation for the consumers, as it really helps manage their costs at a more affordable option. For those who don't enroll into a prescription drug plan when they should have, there is a late enrollment penalty for those individuals, which is 1% of the average national premium, which is upwards of like, I think, $36. And that's 1% of the average national premium for each month that they did not have prescription drug coverage, but could have. This is a cost comparison of one that is personal to me. So with my mom had a fractured her heel 2 years ago. She had to have surgery. She had to have durable medical equipment to have a bed placed in her main floor of her house. She needed a wheelchair to get around, medications. She has a Medicare Advantage plan. And her out-of-pocket exposure that year was that she had to pay out of her own pocket was $6,135. Now that's extraordinarily high. In most years, my mom, healthy individual, and she pays, out of pocket, considerably less than that, maybe closer to less than $2,000, usually, even less than $1,500 in most years. So in the situation though with my mother-in-law, last year she had a hip replacement. She has a Medicare Supplement Plan G. She paid her premium, her monthly premium. She had a very low cost prescription drug plan. She also needed, stayed in the hospital. She needed durable medical equipment and medications for pain and symptom management. And her out-of-pocket exposure, including that includes her, her premiums that she had to pay. So that was less than $3,000, and most of that was just in premiums. So no out-of-pocket exposure. She's able to manage her budget a little bit more simply because she knows that the only thing she had to pay was out of pocket for her medical expenses was that 200, and last year it was $240 in 2024, $240 Part B deductible. She had to pay for the premium for the prescription drug plan and out-of-pocket costs for medications, depending on what the tiers her drugs were classified into, either a tier one or, tier two or three, was what her drugs were fell into those categories. So, this is more of an extreme example, I would say. So for those who are, having significant medical expenses in a year, but it's a good comparison to talk to your clients when you're talking to your clients if they're thinking of having a joint replacement or they have been putting it, off the hip replacement or a knee replacement. A Medicare supplement plan is going to be a more affordable for them in that year than a Medicare Advantage plan would be. When talking to your clients about Medicare, it's important that you continue to ask them the right questions. Like questions like, how are you paying for dental care? If they're on a Medicare supplement plan, again, no dental coverage, but there are cares that they can get an individual dental plan. Uh, there's options I've recently learned about with Delta Dental and Excelis in New York. Throughout the rest of the country, there's options with other carriers like many different standalone dental carriers, Manhattan Life, Medico, Emeritus. So there's also a lot of different individual dental plans that can pay for dental coverage that you can offer to your clients as well. Important to ask your clients in this demographic, are your final expenses taken care of? So not to burden your loved ones. So like, with a whole life, small final expense plan that can help pay for burial or those needs that after one passes. Those are, very affordable plans that can provide up to, like $25,000 to $40,000 in whole life coverage to cover those expenses. What happens if one gets cancer? A Where Medicare will pay the cost of it, but like you think about it from the expansive cost of what cancer diagnosis does to a family, if they have to go to the Mayo Clinic or they have to go to Sloan Kettering or MD Anderson or whomever, whatever, one of the major cancer institutions in our country, who would pay for those expenses, those travel expenses? With a cancer policy that will pay a lump sum benefit to the uh, beneficiary for upon a cancer diagnosis, those are critical expenses that really help ease a lot of burdens and financial burdens to individuals in facing those difficult situations. And then, are you insured that in the event that one would be confined to a facility? It's important to understand that Medicare does not cover any long-term care benefits. They do have the first 20 days in a skilled nursing facility is covered, but there's no long-term care benefits associated with Medicare. Now for the bonus round. We've completed the main portion of the presentation, and now we moved on, advanced to the bonus round. And glad to let our advisors know that with Medicare supplements, we're offering a great bonus. When you're appointed with two of our main Medicare supplement carriers, Mutual of Omaha or Globe Life or United American, if you get appointed and issue one case in the second quarter, we're glad to give you a $50 bonus. But if you issue 10 policies by the end of the third quarter, that can be a $500 bonus. We have offered this throughout the year since the beginning of the year. So if you're in the process of writing business with either of these carriers and you think you're going to hit that 10 threshold, you'll receive a $500 bonus. And glad to be very excited to be able to help you get to that, and give you the payment too, as if you were to earn that. So I'm glad to let you all know about that availability with this bonus. In conclusion, I just wanted to make sure that we have a strong commitment to be your main source for all things Medicare, for your clients, for your business, to help you provide more value to your clients and help you making more money. With that, we have some excellent marketing and lead generating support that we provide our advisors. LeadStar Marketplace and Medicare Express are two of our top lead platforms that we can provide you access to. And the thing that I'm most excited about is our KAFL Cash Medicare Marketing Reimbursement Program, where we will provide you up to $3,000 annually in reimbursement for eligible marketing expenses. So the that marketing reimbursement is available to you when you have 12 issued policies between February 1st and December 1st of each year. If you have 12 issued policies, that is, you can submit for $500 in a marketing reimbursement. 12 issued policies. Right now, it's for Medicare Advantage, and we can also work out agreements as to what it would be for Medicare Supplement plans as well. But $500 for 12, again, up to an annual maximum payout of $3,000. And then if you were to do 1,000, excuse me, if you were to do 36 enrollments for a January 1st effective date for during the Medicare annual enrollment period, you do 36 enrollments. That can equate to you can submit a request for $1,000 in reimbursement, again with a $3,000 maximum per year. We have contracting with most major carriers, as I've mentioned, and glad to making sure that we can provide you with very strong, reliable compliance interpretations and approval, compliance approval on any marketing pieces. KAFL is in the AmeriLife affiliated agency through our relationship with Icon. So Icon and the AmeriLife affiliated agencies, and able to really rely on the number one Medicare marketing organization in the country right now with the AmeriLife. Their compliance team is fantastic. I've been able to rely on my colleagues and get compliance approval and interpretation very quickly, remarkably quickly. In prior experiences, I've been, it wouldn't be uncommon to have to wait months for a interpretation or a approval on a marketing piece. But now I'm often seeing these approvals come back within the same week, if not within a couple of days. It's been tremendous. So again, if you have any compliance concerns, you need some interpretation on any of the Medicare rules, marketing rules, if you put together a marketing piece that you wanted to send out to your clients, or you wanted to send out a mass mailing to help build your business, I can help you with getting those approved compliantly. Have excellent technology available. Our instant quote tool can provide you with instant quoting available through for Medicare supplement plans. You can get just put in the zip code, enter in a zip code, your client's age, and it will give you a premium. So it's very easy to use. The instant quoting tool, the Sunfire Matrix, the Agent Accelerator links are available on our website at KAFL, KAFL.com/Medicare. And encourage you all to check that out and sign up for access, because they really help make your business a lot simpler to navigate, and making it easier for you to if you're having a simpler experience with quoting and getting answers then you have more time to write business and make more money. So if you're making more money, then everybody's making more money and we're all happy, right? So um, again, does anybody have any questions? I'm glad to open it up for any questions, and certainly um, excited to have it be, open it up for questions, and be sure to reach out to you all afterwards with the recording of this presentation and see how it could be of any continued value. So I know that one question that often is asked is regarding certification, or again, no certification needed for Medicare supplement plans, but for if one does pursuing certification, I can be glad to be of guidance in that. We have a lot of tools and resources available to help make that process as simple as possible. And then for enrollment and for quoting. So, like if you have a client that needs prescription drugs and you're wanting to enter their medications, our Sunfire enrollment tool and comparison tool is tremendous, one of the best in the industry, where you put in your client's drugs and dosage and tells you and frequency, and it'll tell you which plans are going to be most affordable for your client. And lastly, the Sunfire enrollment tool was just equipped recently with the ability for advisors to enter their client's Medicare ID number, zip code, and date of birth. And then it'll tell you what if they are eligible for Medicaid, what level of Medicaid that they're on, and which enrollment periods they would be eligible for with regards to special enrollment periods for dual SNP plans. So again, thank you, everybody. Please feel free to reach out to me with any questions at any time. Number there on the screen, 585-440-2920. You're also welcome to text me at that number. And there's my email. And again, glad to be of any help, any assistance in helping you provide more value to your clients and helping you make more money in the Medicare space. So thank you all for attending this afternoon, and hope you have a great rest of your day, and take care.